Hello, my name is Diamond. I am one of the assistants to the doctor that you're coming to see. Now, you are a new patient, right? Okay, no worries. I'm only asking because we do have a new patient questionnaire that we must fill out, and they send me to do that job, so I'll get that figured out and settled for you, and then the doctor will come in and take a look, make sure you're good, and you will be set to leave and get on with your day, okay? Alright, so let's see. I just have a couple of quick questions before we start. Did the nurse get your height and weight when you were on the way into the room? Do you know what that was? Perfect. Thank you for taking note of that. That's super helpful. Okay, so let's see. Is there any primary concerns that are bothering you today, or were you just doing a general checkup? Okay, just a general. Sounds lovely. How did you hear about our location? Just through insurance provider search? Okay. And what is your marital status? Single, divorced, married, widowed? Okay. Now, how about allergies or any reaction to medications? Okay, 3 allergies. Go ahead and name them. And what's the reaction? Hives. Okay, next. And the reaction? Oh, do you have an EpiPen? Okay, good. And the last one? Medication? Sure, which one? And what is the reaction? Okay. Perfect. Can you tell me, what are your current medical problems? Okay. One second. Okay, what else? Is that everything that you can think of? If you forget something, we'll come back. Okay. Now, besides the doctor who you're coming to see today for the first time, are you under the care of any other physicians? Okay, what specialist is that for? Okay. And what's the doctor's name you said? Perfect, thank you. Next question. Can you tell me any of your previous hospitalizations or treatment for illnesses or disease, anything like that that you've had? Major surgeries? Okay. And about when was that? Okay. Anything else? Okay. I've had that surgery myself, actually. When was that? Okay. That's all for hospitalizations and surgeries? Okay. Who lives with you in your home? Do you have spouse, children, roommates, friends, family? Okay. Perfect. That's it. Okay. How about your occupation? What do you do for work? Okay. have you recently traveled outside the country at all? Okay. Do you say that you would get regular exercise, or is it rare, occasional, often, every day? How much would you say you exercise? Okay. When you are in the car, I know these are kind of random and all over the place, but they're the questionnaire we have to ask. When you are in the car, do you wear a seatbelt? Would you say always, usually, occasionally, or never? Always? Good. That is amazing. We always should. I know it can be a nuisance. Sometimes you just want to get in and go, but really could save your life. Okay, now for smoking history. Would you say never smoked, previously smoked, currently smoked, or currently smoke? Smoked. Okay. And about how much? Are you talking cigarettes? Are you talking vape? Are you talking Mary Jane? Okay. And do you drink any alcoholic beverages, wine, beer, hard liquor, any alcohol? Rarely. Okay. Sounds good. Do you drink coffee or caffeinated beverages on a daily basis? Yeah? Okay. About how many would you say? Okay, that's not bad. Do you use any other street or illegal substances? No? Okay. Thank you. Let's talk about the medication that you're currently taking. Do you have daily medications that are prescribed and or vitamins? Oh, 4 medications? Okay. Do you know the names and the milligrams? You are prepared and ready to go. Okay, what's the first one? Okay, and the milligrams for that? Is that once or twice daily? Thank you. Next medication. For heartburn? Okay. And just once daily? That's 10 milligrams, right? Perfect. Next, I was going to say last, but we need the third. Okay. Milligrams. 25. Once a day. And lastly, milligrams. Perfect. Okay, so this is going to be a medical history. I know it's a little bit long and in depth, but I'm going to ask you the questions on here. This is going to be whether you ever have or had the following, and it'll be things such as diabetes, asthma, ulcers, etc. You simply just need to answer yes or no, and you'll hear me clicking on the keyboard, okay? I have to press 0 for yes, enter for no. So, I'll be able to go relatively quick. It won't take all your time. Okay, are you ready to begin? Alright, if you don't know something, if you're unsure of what that means, just simply ask. I'll be glad to tell you. Alright, let's go ahead and begin. Hypertension, diabetes, cancer, heart murmur, heart problems, asthma, emphysema or COPD, positive test for tuberculosis, blood clots, asbestos exposure, ulcers, colon polyps, gallbladder problems, liver problems, pancreatitis, kidney problems, abnormal pap smear if applicable, seizures, depression and or anxiety, stroke, blood problems, thyroid problems, arthritis, radiation treatments to the head or neck, STDs. Okay. Anything else I missed that you have had that you didn't hear me say? Okay. Now we're going to go to some vaccinations. Just say yes or no. If you have had this vaccine, yes. If you have not, no. Tetanus vaccine. Influenza shot. Pneumonia. Hepatitis A. Hepatitis B. Shingles. Colonoscopy. Oh, sorry, that's the end for the vaccines. Now we're going to go on to tests. So if you've had these tests done, yes or no. Colonoscopy, sigmoidoscopy, bone density test, mammogram if applicable, pap smear if applicable, eye exam by doctor. Okay. Now, I would like to know if you have or have not had these symptoms in the past few weeks or current. Fatigue, yes or no? Fever and or chills? Recent weight change? Headache? Vision problems? Double vision or blurred vision? Nausea? Vomiting? Abdominal pain, diarrhea, or blood in the urine. Okay, a little bit more here. Eye pain, hearing loss, earache, runny nose, nasal congestion, nosebleeds, snoring, hoarseness, chest pain, cough or wheezing, frequent urination, weakness, easy bruising, muscle aches, joint stiffness, stress, trouble sleeping, hallucinations, dry skin, or a rash. Alright, so I apologize, I know it's a little bit redundant, you're probably just like, holy cow, already get on with it. So that is all the questions, oops, there goes my mouse. That is all the questions I have for that. Let me submit this. Okay, now what I just simply need to do is take your blood pressure. I'm going to put that into the system here, and then very shortly the doctor will be in to give you a little checkup, make sure everything's fine. Let me get my blood pressure cuff out. This is one that's going to just go around your arm, and it will tighten itself. So we just have to click it on. Here's the cuff. I'm going to slip this on your left arm. Okay, go ahead and put your arm in here. How's that feel? Is that okay? All right. Now we begin. You will feel it getting tighter, and that should not be uncomfortable or anything, but let's see. Perfect. Alright. Very normal and healthy blood pressure. Thank you very much. You are good. Let me write that in. Good. Do you have any other questions, comments, or concerns for me today, or that you would like to address with the doctor? Not at this time? Okay. Well, you are good to go. Thank you for taking the time to answer all those pesky questions. I know it can be a little bit annoying. You did perfect. We got through it. And the doctor will be in very shortly to see you, okay? Alright, I hope you have a wonderful rest of your day. Bye-bye.